Insiders. Welcome to Keeping It Real with Miss T, where we give you the real tea with a twist. Joining me tonight, I have my tea opinionators, Lisa and Shanique. And of course, my faithful listeners, you. Welcome, ladies.
Hi.
Right. So before we get started, I actually want to take this time to say happy early solar return to my daughter, who will be turning 14 on Thursday, Thursday coming, April 16th. She was an Easter Sunday baby, but didn't fall on Easter Sunday this year. So happy solar return to her. And for some of you, you're probably saying, what is solar return? It's happy birthday. So, but yeah, so to my one and only child, awesome young lady, happy early 14th birthday to her.
Yay!
and happy belated birthday to Shanique on the call, because her son was just celebrated a birthday as well. So happy birthday to your son.
Awesome.
Happy solar return to all of them. Absolutely. So, this COVID-19 is still real, right? And I think this is going to be, this is definitely going to continue to be a topic of conversation for quite some time. I do see that happening. So I'm sure many individuals, just like we see on the news, I really tried to escape from the conversation. I'm like, oh, I don't want to talk about this. But when you talk about what's relevant, what's new, what's important, what's right now, there's every single day, there is something new happening with this virus and some new update and some new revelation or what have you that's happening. So, we have to talk about it because it's important, right?
Yes, ma'am.
Absolutely, absolutely. So now the coronavirus has attacked the African American community hard.
Yeah.
They're stating that Blacks are contracting and dying at a vast rate. People lie, data don't. Right? Data does not lie, or numbers does not lie, but people do. So the statistics in Milwaukee, Michigan, Illinois, North Carolina, those specific states, and there could be more, I'm just going off of those currently, they are all tracking their data. And the statistics are showing that the disproportionate numbers of Blacks are the ones that are infected. In a large, massive numbers, mostly. So, and then the CDC, the Center for Disease Control, have been silent on it. They on race portion or on groups. Like, lawmakers have gotten to the point where they've been forced to write letters to the director of the CDC, Dr. Robert Redfield, stating the importance of documenting particular groups in the USA. And if this, and if this risk is greater in one group versus another group, and if so, why? Give us an explanation. Don't be silent on who's being affected more. We need to know from them exactly what that number looks like. What is your data? Share that out with us. So, and let's keep it real. It's no secret that Blacks often get the poop end of the stick when it comes to healthcare, safety, resources, medical. Dr. Kamara Jones stated that it's becoming unmasking the deep disinvestment in the Black communities, in other words. And that, truth be told, just historically, it's always been historical injustice, residential segregation, racial biasness, and just biasness in the medical industry. And Blacks are often not valued when it comes to these things. So, when, I think you guys can speak to this. When COVID-19 when it first came about, right? And we were all talking about it. We all were like, this is everybody, no matter what color you are, brown, blue, green, red, yellow, orange, rainbow, whatever, everybody is getting it, right? And it's like this virus was like the Oprah of gift giving. Except this is not a gift of giving. This is like, you get corona, you get corona, you get corona. So, however, with the statistics being shown that more and more and more is happening, people are feeling that yet again, Blacks are at higher risk. So, and that's only, but statistics are definitely just showing that. So, it's just kind of crazy. But before, like I said, we were all like, no, it's not biased. It's not a race thing. This
Right.
virus is attacking everyone. But
Mm-hmm.
now with these statistics coming out and people seeing it, there are people in the Black community and in other higher places are feeling that it is more of the African American community that are being affected. What do you guys think of that?
Well,
Well, go ahead, Shanique.
I agree in somewhat, and I don't agree in some senses because, like, if we take example in our state, I was looking at the breakdown. The majority are not African American in our state. It's Caucasian in our state, and majority of ours is in our largest county, which is Fulton County, and then you have some of those outskirts, counties that they're not popular. Like you have Doherty. I think I've heard that once before, but Doherty has the second largest number here, and it's predominantly Caucasian. So in Georgia, it's not that way. But in Detroit, where the majority of Detroit, Chicago, those areas are African American, so of course the numbers are going to reflect higher because I think they're at 40%. In New York, it's not African American. It's mainly, they say, high percent of the Jewish community and Caucasians. So in different places, like in Florida, majority is African American or other because of the population of people from the Caribbean, from the island. So in different places it is, but I totally agree when it comes to African American and healthcare, because it's not to say that they're probably not going, but if they're going to the health department, how well staffed is that health department to get that information to the CDC? So maybe the reason why the information is coming out now is because now they're reporting it to the CDC, or is it that our people are just not going to the hospital and they're just dying and they're just labeling as person passed away for heart or asthma or whatever. They're not labeling it as CDC. So I think that's also a factor.
I was thank you, Shanique, and I'm going to piggyback on that. In the New York Times, it was talking about several factors. One, which those who are very poor that do not have access to the health insurance. You also have another factor involved. They not only said African Americans, but they also said Hispanic. And a lot of reasons why some are not going to the doctor Hispanic-wise is because of the rhetoric of the
undocumented.
Right, exactly. Thank you. And a lot of them are not going and dying. Another reason they mention is in New York, because I was born there, there are a lot of African Americans who are in the public sector, like driving the city bus, and also those who do sanitation and jobs of that nature. So they're literally like in the forefront. Those who drive the train, they're the frontline workers, the grocery clerks. Those are the type of jobs where you normally cannot just call out to call out.
Right.
You're right there in the front line. So that was one of the other factors that they say, and they said for more than 60% of people who work as cleaners are Latino. So again, those jobs are not the type of jobs that you can just call out because, you're talking about driving the train. Somebody got to drive the train. Someone got to drive the city bus. So, and then they were comparing it to some jobs there of the Caucasian group that a lot of them have jobs where they can call out. Right. Where they can work from home. You can't work from home driving a bus or driving a train. So there are different levels and factors of what's going on, and it's just very hurtful to hear if you're talking about insurance-wise and any of these factors. It's very difficult for me to process. These people are human, period. They're human, and at some point, even our frontliners need a break. Yeah.
Absolutely. Absolutely.
Why aren't they getting a break? Whether it's here, whether it's there, I don't care where they are. Why aren't our frontliners getting a break from this to detect? Because of hearing other people have been saying that a lot of the symptoms you don't normally will receive, and you think you're okay, and you're a carrier, and you don't know it. And then you come home from work, you come in, you shower, you change your clothes and everything else, but you don't know whether you have it or not. And as being one of the front liners, you come and bring that into your home amongst your family or your loved ones.
Yeah, it takes a while for it to even come to, surface, they say.
Yeah, and, it's disheartening.
Yeah, I mean, I love the fact that you guys brought up a very, very important point that many may be missing, that somewhere in one of the articles, I think it was around April 6th, it came out that undocumented immigrants were being denied care. Like they were going with their, they couldn't, fill out the paperwork. They were told that they couldn't get the medication. And one lady, she was stating in the article that, she was dying and she had a fever and she was in so much pain.
Oh, Lord,
and it just hurts as a human.
Yes.
That you say that it don't have to be a religious thing, but just to be denied care in a place that say we're the home of the free, land of the free, home of the brave. We can't even get proper care. You're getting, because you're undocumented. My thing is still they're human, regardless of what their status is. They are human and should not be turned away, given this is not their fault. It's no one's fault that this virus is here, but a mad scientist who decided to sit in his or her living room and now think about, let's infect some people. Let's see if we can take control and kill the world. I may be far reaching, but, it just seems like some scientists that created this virus because this is what they wanted to do. Scientists create. This is what they do. They test. And people are becoming a guinea pig. And they probably didn't expect for it to be to this extent that this was actually going to happen.
That's right.
So, my thing is that no one should be denied care. And also,
no
one should not have to pay. No one should have to come out of pocket for treatment whatsoever. They walk in there and they're sick. They should not, this should be covered. 100%.
I think they said that. They said that, no, I lied. They said that insurance will waive co-pays and deductibles for it. But what about those who are undocumented who don't have?
No,
I'll give you a perfect example.
It doesn't matter. Insurance shouldn't even be involved. It shouldn't even be a discussion.
Exactly.
If you come in there on this time.
But that's the only thing that they're doing right now. One of my parents that I know of, she's undocumented. No, she has the I forgot what it's called, the DACA, and her husband is undocumented. So he's been doing his side hustle on the side, which is carpentry and doing some construction stuff. He was not feeling good the other day. She called me and she asked me, what should she do? I said, I'll tell you, because I have allergies. Remember, I was sharing the story. I have allergies. Yeah. So I went to the urgent care. And because I have asthma, they said that they wanted to send me to do the test because I have an underlying issue. I said, I go through this every year. It's my allergies. I don't have a fever. I just cough every so often. I know it's my allergy. They say, well, we don't want to send you without doing that because we've been, we'll be held liable if we didn't send you. Okay, fine. They kept calling and harassing me to the point where I felt like if I don't go, they're probably going to come here in white suit and get me because I didn't want
the alien. This is not DoorDash. We're going to get you. This is Corona Dash.
Oh, God. So I just went and thank God it came back negative. But when she told me, I told her, well, you can go to the urgent care. I gave her the address where I went. Just go because he actually has symptoms. Take him, whatever. She said, oh, the urgent care, the WellStar urgent care will not allow us to pay because we don't have insurance. So you can't just self-pay. I was like, what do you mean? So she said we would have to go to the emergency room. I said, well, then go to the emergency room. She said, well, we really don't want to go to the emergency room because we're undocumented. And I was like, wow. Okay, so you can't go to the urgent care. So I was Googling online trying to find someone. So we found a primary care over there on Windy Hill that would see them for $300 just to see him. Wow. And they saw him, and he gave him a referral to go get the test, which he should have gotten it today or tomorrow. But that's just to show you how some of them are afraid to go certain places to even go get tested because it's another way for the government to track you, and that's what they're afraid of.
Wow.
And so could you imagine, what if they didn't have the $300?
Right.
Well, I mean, just, you hate to think about it, but what could you imagine? He would actually be sitting there
dying.
Yeah, thank you, dying, and then pass it on to other people. I mean, hello.
Yeah.
Oh my, and he wants treatment. He's not, he's not like saying, well, I don't want to go. He wants to go, but he, you sometimes you're put in that predicament where you can't go.
Right.
Exactly.
So why should it be like you mentioned, Ty, about our the motto of America? It's open to everyone, everybody. It shouldn't be just certain people having this amount of money or this particular color or this address. It doesn't matter. Zip code, it doesn't matter. If a person is sick, it's all about not spreading it to anyone else. The last time I checked, so my goodness, open your doors and just let people in. Worry about the other undocumented stuff later. Let's get these people better.
Yeah.
And I take my hats off to Governor Cuomo because I watch his briefings every day. I mean, he gives you breakdown where they are, where they're going to be, where they were. I mean, his thing, and in our beautiful state, I think that, like I just looked at our numbers, we're at 500 or something if I just looked at death. But we're almost at 10,000 exposed.
Wow.
But how much of that is really an accurate number? A majority of our populations are undocumented Mexicans and people from Brazil, Venezuela. Are those people included in that number? Are they spreading it among themselves?
Yeah, absolutely they are.
They are.
Absolutely they are.
And then when most people see them, people going to run away, think they have it, and they may not have it. You may be the one that has it, and you running away from them because the first thing, they're undocumented. You don't know that. So then that opens up another Pandora's box.
Right.
Open up, folks, just let people, if I had a practice, don't matter. I'm not going to ask you any questions. I don't care if you're undocumented. Look, come on in, let's get treated. And that's the way, that is actually what you call I won't say American spirit, but just the human spirit of things and wanting to help people, regardless wherever they're from. Come in, let me help you. That's what medicine is all about. That was the whole purpose of it. Go all the way back, follow history. People, it just don't matter. It's helping people, not because they don't have health insurance, not because they're undocumented. No, help them so they can cease this spread of the coronavirus. That's what it's all about.
Absolutely.
But we also need to know that our community, we're prideful. We will work with the flu. We will go to work and work with the flu until the boss sees us and she'll say, you know what? You don't look good. Go home. Because we know how important it is for us to go clock in to bring that money in 1 week or 2 weeks.
Yeah.
So I think that our state, we don't have the rapid test yet here in Georgia.
No,
I think that all those people lining up at the food banks, we need to be having that rapid testing at the food bank where people are coming to get money to eat and test them. And by the time they get to the end of the line, you can tell them if they're positive or negative.
That's
because right now they are walking around nonchalant, not knowing, but all they know is they're hungry. All they know is the kids are driving them crazy because they're hungry. So I have that cough, but they probably had that cough before because they're smokers. So they're not equating
exactly.
Cough. You see what I'm saying? So they're not equating, I have chills. Oh, it's because I was outside in the rain. You know how we are. We have so many myths about certain things that we get comfortable with it until it is too late.
That's right.
So we have to meet, Miss Ty's the one that showed me that phrase when I first met her, meet people where they are. So we're giving them our food. Let's swab them. By the time they get to the end and get all their groceries, we get here's your meals for a week. You're negative. Here's your meal for a week, but you positive. Come over here. Let's go ahead and get you to the nearest hospital.
Exactly.
Something. Because if we don't bring it to our people a different way, because our people are not going to voluntarily bring themselves to you. They're not.
No.
They're not. Because a lot of them too are either on probation, in violation of something. So also, it's not only the undocumented. A lot of African Americans, I was watching one of the shows the other day. The guy was supposed to, the girl wanted him to go testify on her behalf. But because he knows he is not 100%, he's like, I'm not going in that courtroom. Because he knows if he go in that courtroom, there's a chance where he may not come out.
Yeah.
So we need to bring this to our community. Go ahead and get these tractor trailers handing out food, and go ahead and test these people. So then now we can keep an accurate track of those who are who have the virus, who are asymptomatic, or who have the virus, who have symptoms, but it's just not going anywhere.
Well, and I'm listening to, and Ty, if you don't mind me interjecting, and listening to what you were saying, my mouth just had all these words at the end of it, my tongue, and I'm thinking, in one sense, okay, we gather together for food, and I'm not pointing blame on anybody. Okay, I understand we need food, but please help me, correct me, and I don't have a CPA. I don't have a PhD, ain't got an LPN, RN, and MD. None of that stuff in my name. But please tell me, you're going to get food and you sick.
Yes.
What the?
Yes.
What? So the idea that you had, and hey, swabbing, let's swab. Yeah, that's a great idea, because I'm like, wait a minute. Food is this wonderful thing for the body, but if you're sick, God forbid if anyone should happen to have the coronavirus there. I mean, hello, what's more important at this point?
Yeah. What if you're
is the overemphasis of food for the pantry, the overemphasis of that over the corona? Because I was just reading some parts in Powder Springs how they have the food pantry. I don't think that's all good and fine, but okay, I don't see. Okay, what's up with the coronavirus? Why aren't we being okay? And I understand it. You know, a lot of folks are concerned. I'm talking about higher ups, but at the same time, I'm saying, are we kind of like understanding? Okay, we're getting the food, but at the same time, you might be sick.
Yeah. How are you helping those people with that mindset that they're only living for today? I want to eat. But don't you want to live? But you ask yourself, what's going to happen to a single parent, male or female, mom or dad, 3-4 kids, and they don't feel good? If they go to a hospital, who's going to watch those kids? You have to think about that as well. How can someone go to when I was having difficulty after having Shemaya, and I would have the small bowel obstruction, I would have problems. The kids would be sleeping. He would rush me to the emergency room and come back home and stay with them, because I didn't want my kids in the emergency room. But what would I have done if it was only me?
Yeah.
How could I go to the emergency room if I had potential bleeding, and who's going to watch my kids?
Yeah.
So you think about single parents, and majority of them are African-American parents or undocumented parents, because one husband or wife has been deported and one person is doing their best to take care of the kids. So how can you go to in a hospital when it's only you?
Right. Or a person's parent where the parent is in the service, whether it be the husband or wife that's serving in the service. So they technically are a single parent rearing the children because they're not home. They may be married, but their partner, salute them, thank you for their service. They're serving the country. So that parent is technically a single parent rearing that child, because that other parent is not there due to them serving our country. Or, they're working out of town. They have a job that they're working out of town on a consistent basis. They travel a lot on their job. So,
now they're stuck because of the virus. They're stuck and they can't come home, or they're incarcerated. So you have a lot of different definitions of what a single parent means. It means one adult in the house with a child. What can you do when you need to move, when you have, like I always tell Mario, I have luggage behind me. I can't just get up and move because I got 2 luggages. Elijah and tomorrow. So I can't just get up and move like that. I have to think about them when I do move.
Yeah. Yeah, well, and I will say I'm guilty about going to the doctor. I believe that, vapor rub cures everything, and going to the spa and, peppermint oil, I think that cures everything for me. I just lay down, take a nap if I can. But so I'm guilty. I go once a year for my checkup, my annual, when I'm like, that's all you're getting from me. I'm not coming to the germ-infested place. But ignorance, pure ignorance. But you're correct. Of course, if it really got bad, I would need to go. But I tell you, every day I sit here and pray. Y'all have no idea. I'm sitting here and I'm like, Lord Jesus, please don't let me get sick, because I can't go in there. I pray I can't get corona. I'm thinking about all the disgusting things and things that's happening. I can't, Lord. I'm like, Lord, keep me well. I'm dousing myself down with all types of vapor rub and peppermint. Y'all should see me just oily looking a hot mess. So
you probably look like a big peppermint stick walking. You smell like a big peppermint stick, right? And it's all good.
Listen, yes, I do. Vapor rub, peppermint, and all. Because I'm like, Corona will not get a hold of me. I may have to create me a song like all those people creating those crazy viral songs. Corona is not getting a hold of me.
That's right. That's right.
If you don't mind me add, because Miss Lisa mentioned something about the people who are, frontline workers who are working, like the people who work at the grocery store. These people are tired. They're working.
Yeah.
I called one of my friends. She has been working nonstop. She hasn't had a day off yet since the coronavirus started. Perfect example. I told you my husband's helping me with the garage, and so I ordered stuff online for me to just go pick it up. But when I called, they said they're so busy they didn't have to pull my order at Home Depot. They said I can just come pull my stuff myself and then just check out. So when I got there, I didn't find everything, so I added more things to my cart or whatever. When I got there, you could tell the man was exhausted. He was just like, okay, let me go ahead and check you out and leave. I'm like, no, sir, I got more stuff in my buggy. So, okay. So, well, I'll let you have this. I was like, you can tell that man's mental. He was done. He was done. Like, he couldn't take it. He didn't even look at the cart to see that I had bleach. And if he looked on there, I didn't order bleach on my thing. I just picked up the bleach because I only have 1 gallon left. So he was just so exhausted. Like, okay, ma'am, I'll just check you out. You just go. I'm like, no, I have to pay for the rest of the stuff. But that's just to tell you and show you how his mental is not here anymore, and he's tired.
Yeah.
And when you're tired like that, again, you can make yourself susceptible. Yes. Am I saying that word correctly? Susceptible. Excuse me. Thank you. Susceptible. Thank you. To the corona virus or anything. It could be also the flu. My daughter's frontline and my son is frontline workers, and I said to them, I said, I don't care if your company is not giving you this, you make sure you have it on. And they do. They wear it anyway. My daughter was never provided with gloves. She has her own gloves. She has her own mask. My son's job had provided him with gloves. And I said, see, it don't matter if your company is not giving it. You provide your own PPE. You are your own advocate. And and I understand people have bills that they have to pay. Oh my God, I know.
Yeah.
But sometimes if you take a day off just to collect your thoughts, collect yourself, instead of just running, I'm telling you, it's not good if that worker ever gets sick. That's not a good thing. And I'm not talking about just the corona. I'm talking about just in general, or just having out of anxiety. That's difficult as well. So you got to take care of yourself, because again, it has nothing to do with the American spirit. It's the human spirit. If you're a manager and if you're listening to this podcast, you should be. And if you're on here, give your workers a break.
Yes.
Give them a break. Give them a break. And you as a manager, if you are an effective manager, give yourself a break as well. Everybody needs a break, and then get right back into the game. It's okay to be busy. It's okay because right now these are busy times and unusual times for many of us. So we are in the game, come out of the game, and then go back into it again. So everyone who's listening to this podcast, please take care of yourself. Don't let yourself run yourself ragged, because you leave yourself open to so many things, as well as anxiety. So please take a break and get back into it.
Right. And Lisa, I loved how you made the statement about the, employers. Definitely listen to your employees, be in tune with them, because I found a great little quote on Facebook. Someone did a post, and they were saying, pay attention to how companies treat their employees during this time.
Ooh,
it speaks volumes to their core ethics. Again,
exactly.
I'm going to repeat that again. It says, pay attention to how companies treat their employees during this time. It speaks volumes to their core ethics. So that talks about, because what they don't realize is that no matter what position you're in, your company could not surface or could not be able to run as smooth as it's running without the team that you have under you. It wouldn't be able to run because you're not there physically, and maybe you are there physically, but no one can do it alone. I know that for me, I can't do it without my employees. I can't do it without my staff. I need them. I mean, yes, I can multitask, but you still need a team. There's nothing greater than a team when you are able to delegate it out to someone else. I truly am grateful and thankful for the team that I have in place, because I know if I need something, I can count on them to follow up with whatever they can. So, employers have to remember that you have to treat them with respect. You have to know that at this time, whatever it is that they need, you need to be there. It is not a time, if you see, they don't have to tell you they're tired. You can hear it. You can see it. I mean, it's in the body language, it's in the eyes, it's in the mouth. And the mouth can be dry. Some people sit around, they won't even take a lunch break. They'll just continue to go because they're that drive, and they are looking for 5 o'clock to come, or whatever their hour is, at 3 o'clock in the morning, whatever time they're getting off. They're looking for that time just to get off, and they may not even be thinking. So it's also a mental thing, and mental illness is real. Stress is real. Anxiety is real. And you can be stressing and having anxiety without even really knowing it. You're just going, okay, I've been in that position. I just go. And then I start feeling nauseous or getting a headache. And I started, you know what? I have not taken time to care to get something to drink because I'm so in go mode. We have to all make sure that at some point in the day that there is a schedule where we know, and we have to stop and think and take care of ourselves, because if you do not take care of yourself, you cannot take care of anybody else. And you cannot effectively nor efficiently do the job that you are designed to do without being the best you in that moment.
That's right.
Absolutely. All right, ladies. Well, that was some good stuff right there. So I think we can move along to the next topic. We're going to try to give it some balance here, because we do talk about the coronavirus a lot lately here because it is relevant, but we also must still talk about I think we kind of smoothed into this about anxiety and stress and things of that sort. I wanted to touch on the buffoonery of reality TV. And this is a topic that continue to go on too. And I'm not a huge TV watcher, but when I do watch it every day, every once in a while, I catch those crazy reality shows. Let's talk about the different Real Housewives of Atlanta in all different types of states, not just Atlanta. You got Beverly Hills, Orange County, you got them all over now, Potomac, everywhere. And then you have the, Jersey Shore, Keeping Up with the Kardashians, and The Bachelor, and it goes so forth and so on. I mean, it's just so much buffoonery out there. We have to be careful what we're intaking and what we're putting into our minds, into our body. But I said the reason why I brought this up is because I'm concerned about our young girls. And I was switching through the channel, and I so happened to glimpse at the Real Housewives of Atlanta. And I saw how the ladies were just fighting. And I just see episode after episode, they're always fighting. And it's like, not diagnosing anybody, because Lisa, like you said, I don't have anything in front of my name or behind my name with those CPA, whatever, LPN, RN. But these young ladies are toxic and come off as kind of bipolar. I mean, one minute they love each other, and the next minute they fighting, and then they're calling each other names, and then they come back again, they love each other again, then they talk about each other's children and spouses. And you just don't want our young women looking at that and thinking that that's okay. That is toxic behavior. Now, we know that, and we have to tell the young ladies, it is imperative that when you look at it, those people are real people, but they are entertainers. So you want to make sure that we're looking for real people to inspire us, not actors or actresses on reality shows. Now, yes, the participants, once again, are real people filming for a check. They have to keep their ratings up. They got to keep their views up in order to do that. So, and we know that it was a saying that say, money talk, bull crap walks. But in this case, money talks and bull crap talks. You have to have, you got to bring forth some bull crap to keep those ratings going and to keep that money coming in their pocket. This is what they do, but that can be dangerous to our young female viewers when these women on television act this way. And then they have the audacity to be ambassadors of all of these different young girl groups and young girl organizations. And I'm like, but you were just yesterday or whatever you taped fighting whatever your co-partner is on the show, smacking her and embarrassing her and calling her everything but a child of God, or calling her out of her name. But now you're over here preaching on top of, or speaking on stage, telling young girls about being beautiful and about being positive. But you weren't just being positive. So it's a toxic mindset and toxic behavior that we have to let our young girls know that that's not real. But they're real, because even on the outside, this is how they're acting when they become on the real world. When they turn off those cameras, they're still those same people, regardless. Their character is their character. Your moral integrity is what counts. So we have to do better as women on how we walk and how we lead and what we get ourselves into. Every dollar in the world is not a good dollar.
Yeah.
No.
Yeah. So,
well, I hear what you're saying, and like for me, I just use it like I tell some of my friends, and I said I have to get my ratchet fix, sometimes, or my ghetto fabulous fix. I get it where they dress to the nines, wearing $1,000 outfits, but then again they act like someone around them, like in Miami, we had the Poke and Bean projects, just like the girl from around the corner. But my thing is that they do it for money. That's why they keep apologizing every season. They apologize to each other, because guess what? They have to start the momentum next season.
They're Apollo lying.
Apollo lying.
Yes, they have to go in there and next season they start working it out, and then midway they fall out, reunion, they make up, and it's like a yo-yo. But one thing is that one thing I noticed that I don't know if you saw the Kardashians episodes, one before last, when Kim and her sister Kourtney had a fight.
Yeah.
Now Kim is very, very controlled. She's very controlled, where Kourtney is not. So she most likely is the one that's always crying or sure saying things. But Kim is very calculated, and she's very controlled on what she do and how she does it. And if you ever catch her out of character, meaning the character that the character that she portrays for us to see, so when her and Kourtney was getting a fight and Kourtney hit her, she pulled back. But then again, she's like, I can't let people think that I let her beat me, and she went back in for the attack. So you can see where she pushed her. She was just play hitting, but then Kourtney didn't take it as that. She slapped the living day out of her, and then she backed out, and she's like, you know what? She thought about it. And if you see her eyes turn around and she saw the cameras were there, she said, oh, no, I'm not going to let you hit me on camera. So she went after the poor girl, and then they went and they got at it really bad. But my thing is that they're human, just like you and I. Yeah. And one of my things is, I don't know if everybody knows this about me, but if someone ever spit on me, I think that would be the end for them. I'll take a lot of things. But if somebody
ain't doing no spit
in my culture, that's like the worst thing you can do to somebody is spit on them. I've never had somebody do that to me, and I pray, Lord, my 42, I live another 42, and nobody ever do that. Because I think if somebody spits on me, Lord, I'll take somebody pushing me by mistake. I'll take somebody snatching, but to spit on me,
No secretions. No, not a good thing.
Fluids and changing. We don't do that over here. So I felt her when she felt like that girl hit her, and she turned around and she saw the camera. Then she went back in. But Kim is very controlled, and she felt that, and I know she knew immediately she went out of character, but she had a financial thing to do, which is what? She needs to stand her ground, or then guess what? All the trolls, she got beat. So she had to go in there and do it, even though I don't think that's her character to do that. Now, Chloe's the one that would hit you, and you can see she would do that. You don't even have to pay her. She'll do it for free. But Kim, because she knew that it would have been a negative impact for her to let Kourtney hit her and her not retaliate, so I think that's why she did. And then just like the girls from the Housewives and the other, they constantly fight. And I saw one of them is Portia, and the March of Dimes. She's now a spokesperson. I think that people can grow and people can evolve, Me, honestly, I don't take them for who I see them on there. I don't think that the people that I see on the screen is 100% who they are. I know that they have to instigate. I know they have to make the show spicy. So for me, I don't really think. I do see a difference in her from when she had that fight with Kenya on things. After she had the baby, I see a difference. She was still spitfire with her tongue, but I don't see her rush to go in people's faces, which I think she has grown and mature. So I think that for her, going where she's going with the March of Dimes so she can represent young African-American women from the age bracket of 20 to 40 that are having difficulty with pregnancies, that I don't mind. But for Nene, who I love Nene, I love her pregnancy, but for her to try to spit on the other one the other day, and then she wants to be ambassador, she's on the TV, you're grown. There's a difference between you and Portia. Portia, I'm not saying she's a kid, but she's still evolving. Things that you're doing is what Portia and other people younger than you should be doing. She should be more controlled like Kim is. And believe it or not, even Kenya, she may be the villain of the thing. She's very controlled. You know what control means? She could spit fire with her tongue too, but she barely.
She's the shade queen. She's the shade queen.
Yes. She barely, because she knows that she can fight with her words without having to antagonize you by physically coming into your space. And so I think that's the difference. But me, the people that I see on the screen, they're entertaining. Like I said, my ratchet fix. But I don't think that the people that we see on that screen is who they are when the cameras are off. 100%. I don't think so.
Well, no,
So now, my thing is, and I'm listening to you, and I agree with a lot of points that you're mentioning, and I understand that it's for a lot of people and for them it's entertainment, and that's what they do. That's their check. But I think about when we were in a fight with maybe my girlfriends or maybe my sisters. We were told that we need to make up. We were told that we need to make up, that this behavior is not okay. It is unacceptable. So I see these beautiful, gorgeous women done from the head down to the sole of their feet. Beautiful. Nothing's out of place. And so when I see you open your mouth, you don't have to take a swing at someone, but when I see you open your mouth to someone and trash comes out, you're talking about, you're defaming, you're bringing down not just yourself, but the person in front of you, whether they are your sister because of color or because of being in the same family. We have, as women, I love being feminine. And to me, what part of femininity is being able to control yourself in all situations, except for the spitting part. Now, we talking about somebody spitting on you? No, that's going to be a little different. However, outside of that.
She digresses, both of you digress.
But to be able to control the situation and to bring a person's temperament down when they're upset, that's work. That's a woman.
Absolutely.
That's the kind of women. Those are the kind of women that I'm used to being around in company that will not allow somebody else's feelings dictate the way they should feel. You having a bad day, right? Oh yeah, you having a bad day. Okay, great. I tell you what, I'll come back to you later. I'm not going to stand there and instigate anything. For what? And I don't have to get paid for this. I don't need to be on social media. You see me beating someone up and cursing someone out. For what? It's not necessary. I don't need followers. The word femininity is not just what we wear. It's not the color of our hair, how much makeup we have, and everything in place. It's what comes out of our mouth. Yeah. You're calling your sister a bee. They're referring to you as a bee. What?
Right.
And I ain't talking about the bee that flies around and gets honey. Okay. Okay. We already know that.
Absolutely.
So that makes honey. So I'm not saying that type of bee, but we as women, even with my sister, I would never think about picking up my hand to hit my sister. And if I did, we would have to make up. We may have to exchange verbal, but After that, my mom said, no, y'all gonna have to make up because we all live in the same household. Yeah. So we may have not liked each other in certain aspects, and that's natural as human, as Shanique mentioned. However, it's the line in the sand you cross, attacking your sister, whether we're talking about a family or of just being a woman. Why would you want to attack? And I got it. You want to do that for ratings and you can go to sleep at night and feel good about it? Well, maybe you can because that's what you're probably used to. And probably, like Shanique said, most of that is put on for the camera. But then again, you don't need to entertain the world like that. Is that the only talent you have?
Really? No. And a lot of them are talented in so many other ways, but that's that easy. This is that easy money for them. This is that ratings, and it keeps people wanting more and coming back. And it's like a Ferris wheel. You know, it keeps going around and around and around, and eventually somebody's going to get off, but then somebody gets back on. So it's just sad. But I said that all to say that, you know, I'm not saying not watch those shows. You know, if that's someone's, we're not saying that. Yeah, if that's someone's liking and that's what they choose, my thing is just we just have to be mindful that we're rearing other young ladies, no matter what the color of their skin is. We want young women to know that this world is not just toxic. This world is not just full of toxicity. And you don't have to put your hands on someone or down someone verbally. There's other ways to get around things. You know, the whole turning the other cheek or watching how you respond. Your problems are not everybody else's problems. And oftentimes when you're able to walk away from a situation and be the bigger person from it to avoid any additional altercations, then you know that it's all as well, because they can't argue with themselves for too long. They can curse all they want, but after some point, it's all going to become mute. Exactly. So, so yeah, I mean, that's why I brought that up tonight. So I really do truly thank you guys for joining me on this platform tonight and just being here and being present.
Oh, my pleasure. Yes,
absolutely. So Hindsighters, thank you for joining us tonight. And please join us next week, same time, Monday, 7 p.m. and 9 p.m. on the same platform. Keeping It Real with Miss T at www.hindsightmediaradio.com on Hindsight Media Radio 103.5 FM, where we always give you something good to talk about. Visit our Facebook page at Keeping It Real with Miss T, where we give you the real tea with the twist. Be safe and stay well because you matter. Good night.
Good night.